Are you one of the many patients struggling to control their blood pressure despite taking multiple medications? Well, there's new hope for you. Welcome to Telangana today. In this video, we bring you details about a groundbreaking treatment for chronic hypertension called renal denervation therapy. This unique therapy has shown promising results in treating patients with resistant hypertension. The therapy targets the overactive nerves around the kidneys, which play a crucial role in regulating blood pressure levels. By reducing their hyperactivity, blood pressure can be controlled instantly. The procedure is minimally invasive and is performed by interventional cardiologists using a catheter to deliver heat energy to the renal arteries, the blood vessels supplying the kidneys. A catheter is used through the right groin to access the artery that supplies blood to the kidney. Through this catheter, heat energy is delivered to specific points, ablating the renal nerves without damaging the arteries. The therapy led to positive results. One of the patients who was on 3 hypertension medications experienced significant improvement after undergoing renal denervation therapy. In some cases, this therapy may eventually reduce blood pressure medications, and for the few lucky ones, it could even lead to the permanent discontinuation of those medications. The therapy has made possible by a specifically designed catheter called the Simplicity Spiral Catheter, recently approved by the Drug Controller General of India.
A lot of our people do not realize that hypertension is a silent killer. It is one of the leading causes of heart disease as well as brain stroke. And a significant percentage of our hypertension patients are not adequately treated. This could be because they are not adherent to the drug medication regime that has been recommended by their physicians, or it could be because of, in spite of taking multiple drugs at adequate doses, many of these patients do not respond the way we expect them to respond, and because of which their hypertension is not well controlled. There are several risks of the blood pressure not being controlled to a level, to a target that we want it to be controlled. It could lead to deleterious effects on the heart, on the brain, as well as on the kidney, and have long-term consequences in the form of brain stroke, heart attacks, or kidney failure. Therefore, it is very important for us to realize and recognize the fact that some patients have resistant hypertension. So what are the options available for us to treat patients who have resistant hypertension? A new modality called renal artery denervation therapy has come up to be very promising, and this helps patients who have resistant hypertension. In this procedure, this is a small procedure in which we perform the procedure under local anesthesia. We put in a small tube or catheter from the artery in the groin right up to the artery that supplies blood to the kidney, and we perform radio frequency ablation of the nerves that supply the renal arteries, the arteries of the kidney. So by targeting this nerve supply of the kidney, we reduce the level of hormones that are released to the kidney that are responsible for high blood pressure in many individuals. So this is called renal artery denervation therapy, and this is a promising modality that is coming up in a big way all over the world, and it holds huge promise for all patients who have resistant hypertension, whose blood pressure is not controlled well enough in spite of multiple drugs in adequate doses. And we are happy that we have started the program of renal artery denervation at our hospital at Yashoda, High-Tech City, and we plan to take this program forward in a big way and to help patients who have resistant hypertension. The renal artery denervation can indeed be a boon for many of these patients whose blood pressure is unable to control in spite of optimal medical management.
If you are tired of struggling with high blood pressure, renal denervation therapy could be the answer you've been looking for. Consult with your doctor to see if this innovative treatment is right for you. For more such health-related news, subscribe to Telangana Today and stay tuned.